Hi, ladies and gentlemen. Hi. I want to warmly welcome you to a little beginner's tutorial on how to navigate the eCTD portal for SAHPRA. So, if you are planning to work in regulatory affairs, if you're already working in regulatory affairs, if you need to do eCTD submissions, as a regulatory affairs activity, maybe this will be useful for you. Let's dive right in. Okay, so I'm going to share my screen and we can head on over to SAHPRA. I hope you can see that. I'm just going to type in SAHPRA and then we can start streaming. So I'm going to do a separate video on how to navigate this whole entire website because there's tons of really good information on here. But for today, let's go directly to the e-services and drop down menu to eCTD submissions portal. So there's a little urgent notice here to let you know to use only your application name as your folder name and nothing else, no suffixes or anything else. And that you should use the new version for the XML file templates and download the latest trigger file. Okay, so how do you get in here? You can click on Get Started. And it's going to take you through all of these top navigation headings. The objectives of this portal, it is to submit your applications, right? So ideally, you would have already compiled them and you would have, drawn up your modules and all your files. You would have the folder ready to go, and then it would be in the suitable formats, and then you could just drop them here. There is a frequently asked question PDF that you can download and read through just to help you on how to use the portal. There is also a user manual that you can read through, so please do that. There are specifications here that you should also navigate through. Again, always remember that regulatory affairs is about regulations primarily, so you will need to read. There's a lot of reading that happens, a lot of information that needs to get transferred. Okay, and then it goes to the technical files. You can either click it up here or scroll down, and then it tells you there's a lot of documents you can click on here just to read some more. Okay, your SAHPRA util folder, you have your checksums, and then all the defined list and validation matrices. This is just to give you more context. There is an example that's already compiled here for Module 1 that you can have a look at. And there's also a sample trigger file. So for all my Academy learners, you should come here as supplementation to the short course, Module 1 or 102, and also an instruction for the envelope. Okay, then there's a little note about vendors. SAHPRA doesn't necessarily recommend any specific software. As long as it's an international standard, you're good to go. In the past, they used to use eCTD. Nowadays, they're on to DocuBridge. We have a DocuBridge and an eCTD training for our Academy learners. But if you're interested in either one, or even some of the others that's out there on the market, have your pick, but just know that they are currently using DocuBridge. And any portal inquiries you may have, there's an email for support. All right. So let us go to the actual SAHPRA eCTD portal. Okay, here you're going to need to log in. I already created a profile um, just because of our organization and training purposes. So we're going to come here. This is what you see when you just get in. um, Applications and approved products. So you can navigate through that, see what kind of applications you have under drafts. At the end of this, we're going to see our draft here that we created, and then we're going to be able to delete it because it's not a real submission, but let's create one. Okay, so we're going to go into health products. There's also a section 21 option there. And then we're going to click next. And here you see it opens into three options. So as I always mention in the first class of our RA short course, these are the three application types that you get. It's either going to be a brand new application, or it's going to be a variation application, which means there was a prior registration of a product and now you're making a change to it, or it's going to be a renewal. As you know, all applicants or all applications need to be renewed. So you have your 5-year renewals to do. So we're going to click new, which is already selected. And then you can choose here between biological medicine or orthodox. We're going to pick orthodox just for the purpose of this demo. Biologic medicine is any blood products or plasma products or products that have human material or biological material. It could be from animals, it could be from humans, but it has active biological elements to it. So even vaccines are considered biologicals. You have biosimilars and all of that. So there's a complete short course on that if you're interested. But for now, we're going to do orthodox because these are the most basic and common type of medicines you get. Then we click next and it comes to another 3 type of submission. You get baseline, which means if your product dossier had never been formatted to eCTD, perhaps you were still on MBR or MRF, you would have needed to convert that format, scan all your documents in, and create an electronic version, and that would be your baseline. The call up for that was a long time ago, so technically no more dossiers should be in any other format than CTD or eCTD, but there still are a few strays, so you may still find one or two. A new chemical entity is your next option. This is if you're registering a brand new compound. It could be brand new in the entire world. It could be brand new in your specific country. So it must be novel to South Africa because we're going to keep it in context. So it must be a medicine that has never been registered in South Africa, and therefore that would be a new chemical entity, even if it's registered elsewhere. And then you have multi-source, which is all of the rest, the generics. As long as the API has already been registered in the country, you're now applying as a generic or a multi-source. Okay. So we're going to pick multi-source again, just because of the tutorial and this being the most abundant type of registrations that you get on the market. And now we come to the application information. So under submission information, it gives you a few options for the procedure types. If you want more information on that, I have another video talking about the submission types. procedure types. It's in the book as well, the RA Handbook for Beginners. You can find the link in the description. But these are just different types of procedures that are permissible to register a medicine in South Africa. You can use an emergency use listing, for example, during a pandemic or when there was COVID. Remember, a lot of products were coming in through this means or procedure. I remember ivermectin was one of the very common examples or very prominent examples at the time. And then you have a whole lot of other procedures. We have AMA here for the African Medicines Agency. So that's just a procedure that's set specifically for the African Union. You have the work sharing per country. You have EU M for all. You have Swissmedic. You have the WHO, SRA. You have WHO pre-qualified. You have Zazibona, which recently opened. I think it's been a year or just under 2 years now, the pilot phase. So that's really exciting for the Southern African region in Africa. And SAHPRA, the national procedure. So we're going to pick national procedure just because. And then you have evaluation pathways. And again, here, the drop-down menu gives you options as to how do you want your dossier to be evaluated. Do you want to pick an abridged evaluation, meaning you have a few couple of reliance documents that you're hoping to fast track it on? You have different types of abridged, right? But this just means that it's already registered somewhere. There's already been prior approvals elsewhere, and depending on the subtype of abridged, it may be a verified, it may be that you already have an outcome that you're approving, that the authority is approving. It may be that they're just gonna review some or part of the dossier of the data provided, as opposed to full, which means every single part of that submission is going to get evaluated. Then you have priority. Again, if it's an emergency or a pandemic, you may submit that. If it's a rare disease or like an emergency type of drug that's needed, you may use that. You have rolling review and Section 21 for unregistered products. Okay, we're just going to pick abridged. Again, that's one of the most common ones with multi-source. Full is usually for NCEs and other types. And then we go to product information. We now need to classify this product of ours into anatomical, therapeutic, chemical classification. So agents acting on the renin-angiotensin system. Okay. You have all other non-therapeutic products. You have all other therapeutic products. You have allergens. You have amphotericin B, antibacterial for systemic use. You have a whole list: anabolic agents, analgesics, anesthetics. You have anthelmintics, anti-acne preparations, anti-Parkinson's, a whole lot. All right. So we're just going to pick at random because it's a tutorial. We're not going to be fussy, but in real life, you would have to correctly classify yours. So let's say this is a muscle relaxant. Submission details. Is it the master or is it a master plus duplicate? So this just means that when you make a submission for medicine registration, you have one product, right? That is your master, the first one being submitted. But you can always opt to have duplicates with it. Sometimes you may submit a master and then decide, okay, well, I actually want to submit other generics under the same dossier, but maybe with different names or with different indications or directed at different population groups. So this is one method that a lot of manufacturers use to market share. They can, an example I'm thinking of is ibuprofen 400. You could have ibuprofen 400 as your master, and then you can advertise it under IBU 4. You can have a duplicate under IBU Extra for period pain, which it's the exact same dossier, strength, product, but the name and the indication or the marketing will be slightly different. Okay, so let's say it's a master and just the master. Now, the route of administration is obviously how is this product being administered? Is it an oral pill? Is it an oral liquid? Is it an ophthalmic ointment, eye drops? Is it topical? Do you gargle it? Do you inhale? So all the different types of administration routes will be here. Is it vaginal, transdermal, topical, rectal? We're gonna say it's oral just because most tablets, syrups, capsules are oral. But had it been a suppository, a pessary and things, it could have been rectal, vaginal, whatever. Okay, dosage form, again, is it oral, chewable tablets? Is it effervescent tablets? Is it enteric coated? To protect the stomach? Is it an extended release, film coated, granules? Like, what is it? And all these really make a difference in terms of when we do bioavailability, when we check BCS classification, um, for bio waivers, when we check um, a lot of things anyway, you know. So let's say these are chewable tablets and the indication. Okay. Again, a drop-down list here. We have 0, no problem, 1, mild, and we have all these kind of issues here. Is it for bipolar? Um, is it a bismuth salt? Is it for adrenal gland disorders? Is it for cod liver oil? Is it for cleft palate? Is it for dementia? Is it for duck feathers? I mean, you get every kind of indication under the sun here. So you really have to go down this drop down alphabetically. Is it for TB? Is it for zygomaticus? Vertigo? Is it for, you know, you get the gist. So let's say our product is um let's say it's for tetanus. Okay, very random. You could insert multiple indications here if there were more. We're just going to leave it as one. And then with the pharmacological class, again, you have to say what kind of classification does it fall under. So we're going to pick at random again, just for tutorial purposes, but do note that it's all supposed to match. So you can't have a muscle relaxant and then say that it's for an antibiotic or an antihelminthic or, you know, something else that's irrelevant. So, okay, now we go to the next section. Was a bioequivalent study conducted? Huh? Yes or no? Well, now you got to know in what cases is a bioequivalent study needed? And do you need to conduct one for this case or not? If we say no, it goes on to, does your submission include additional clinical data? But if we say yes, now it wants the CRO name, which is the research organization's name and the study number, because then it's going to go directly to it. But let's say no, we didn't need a bioequivalence. Maybe it was an IV. Oops, I lied. It was an oral. Usually with IVs, it's an automatic waiver, but with oral, we now have to see, is the same amount of concentration that you get absorbed from your stomach going to reach the plasma? And is that the same as what the original product, the NCE or the originator product has? Is it equivalent to that? So we're going to assume that we have our own clinical data, so we don't actually need to include equivalence data. So here, does your submission include additional clinical data? If yes, great. If no, maybe you're going to be in trouble. But okay, let's click yes and continue. What's your API manufacturer details? Now you have to put your details from who made your API. This is assuming you are, excuse me, this is assuming you are just an applicant. You may be an FPP. You may be the API and the FPP manufacturer. Whatever the case is, type in here. So who made our API, or what is our API name? Let's just pick another random Allopure. Let's pick allopurinol just because. Okay, let's pick allopurinol. And here comes a few examples, and some have, okay, Amsterdam, Mumbai. By the way, a lot of these API manufacturers, guys, you'll come to know are from either India or China. I'd say like 90%, and then the rest of the world. So let's just pick the first one, right? It says it has a CEP. It shows the CEP number. It shows there are no revisions, or this is revision 0. So, it may actually be an expired CEP, but that's not the focus right now. Let's just continue. If you had more, you could add another one here. Some dossiers have more than one API manufacturer. It is advisable to have multiple. The more you have, the better. Not the more, but if you have 2 or 3, you're good. Just in case one of them shuts down, or one of them is out of stock, or one of them has some sort of issue, you won't have to apply for variation. You won't get stuck with your manufacturing. You could go to the other one. And then your FP manufacturing detail, you got to give a SAHPRA reference number here because they should be registered with SAHPRA. If it's your own pharmacy or number, sure. So we're just going to type 0001 just because. The name, we're going to say Farmers. And for manufacturer role, we're going to say we are a release control. Okay, so we don't do the actual manufacturing, but we just control the release. So we have another external or third-party manufacturer, okay? If you were the manufacturer, you'd pick this one. If you were the release responsibility, you'd pick this one. If you were a primary packer or secondary packer, you'd pick those. But let's just go for this for now, just to keep it moving. If you have a second one, you can add. And there you go, planned submission day. This is going to be dependent on your readiness. Let's say your dossier is all done, your tests are all done, you've made all your payments, you're good to go. Then we can say we're going to be ready on the 1st of August. That's pretty close from now. If you needed more time, maybe a year, maybe you still had to conduct some stability testing protocols, if you still had to get your stuff together, maybe you're still doing your batches, um, you're still trying to figure out your manufacturing, and you're still doing test batches, you would need more time. So this is just for them to know about when do you think you'd be ready. Okay. So is your master a fixed dose? Then you have to enter the strength from the beginning, but we're going to say no. Now they want your application number. Well, we're just going to skip that because it comes in self-populating afterwards. Proposed proprietary name. We're going to call this Aloe Farmer. The strength is 100 milligram. Going to put the unit of measurement here. And what's your container closure system? Are we using tablets in a little tub? Are we using blister packs? Are we using, what is our closure? Ampules? Do we have bottles, boxes, cans, cartridges, jars? What is it, a vial with a stopper? With oral tablets, one of the most common types will be blister packs. Let's pick that. If there's another strength, we would add it here, but just for the sake, I'm going to say next. Okay, so there we have it, guys. You have your submission number here. It's a new generic chewable tablets, 100 milligram, and the status is now pending. If I am good to go, I'm going to come here and then either view my application under drafts. I can delete one if I want to. I can check whatever else under here. And that's about it. We can um, we can end it here just for the sake of this tutorial. But in actual effect, we would then go on to submit and track it. This would be the portal where you track your submissions. And you would probably have used a software like DocuBridge to properly organize your documentation and then to submit, to make your submission. And this is just for you to then enter the type of submission and provide the dossier, and you're done. Okay, so that's that, guys. That's it for our little tutorial here. If you want to read up on any release notes, you're welcome to come over here. There's always a lot of information to digest, so you can do that. But that's about that. So, yeah, I hope this was somewhat helpful. Send any comments, questions down in the comments below or contact us at Pharmers Academy. And happy learning, guys. Bye for now.